10 interesting facts about medical cannabis. 1. Can be used to treat glaucoma. May be used marijuana to treat and prevent eye disease glaucoma, which increases the pressure on the eyeball, damage to the optic nerve and causes vision loss. Marijuana reduces pressure inside the eye, according to the National Eye Institute. Studies in the early 1970s showed that marijuana, when smoked, lowered intraocular pressure, IOP, in people with normal pressure and those with glaucoma. These effects of the drug can slow disease progression, prevent blindness. 2. It may help reverse the effects of tobacco cancers and improve lung health. According to a study published in the Journal of the American Medical Association in January 2012, marijuana does not impair lung function and could even increase lung capacity. Researchers are looking for risk factors for heart disease. Tested the lung function of 5,115 young people for 20 years. Tobacco smokers lost lung function over time, but using pot actually showed an increase in lung capacity. It is possible that increased lung capacity may be due to taking deep breaths while inhaling the drug and drug treatment chemical. 3. A chemical found in marijuana stops cancer from spreading to the CBD may help prevent the spread of cancer. Researchers at the California Pacific Medical Center in San Francisco reported in 2007. Cannabidiol stops cancer by turning off a gene called ID1. The study, published in the journal Molecular Cancer Therapeutics, found cancer cells make more copies of this gene in non-cancerous cells than it helps them to spread through the body. The researchers studied breast cancer cells in the laboratory that had high expression levels of ID1 and treat them with cannabidiol. After treatment, the cells decreased expression of ID1 and were less aggressive distributors. In weed, Gupta pointed out some studies in the United States, Spain, and Israel. Ramsey compounds in cannabis can even kill cancer cells. 4. Directly affects and reduces anxiety. Medical marijuana users say the drug helps relieve pain and suppress nausea, two of the main reasons it is often used to alleviate the side effects of chemotherapy. In 2010, a researcher at Harvard Medical School suggested that some of the benefits of the drug may actually be anxiety is reduced, which improves the mood and the act of smoking as a sedative in low doses. Beware, though, in high doses may increase anxiety, make you paranoid. 5. THC slows the progression of Alzheimer's disease. Marijuana can slow the progression of Alzheimer's disease, according to a study HDS-HMHKR 2006 published in the journal Molecular Pharmaceutics, found that THC, the active ingredient in marijuana, slows down the formation of amyloid plaques in the brain by blocking the enzyme that causes them. These signs are what kill brain cells and cause disease. 6. Keeps you slim and helps your metabolism. A study published in the American Journal of Medicine on April 15 last year suggested that cannabis smokers are thinner than the average person and healthy sugar metabolism and response, even though they end up eating more calories because of the munchies. The study analyzed data from more than 4,500 American adults, 579 of which were current marijuana smokers, meaning they are not smoked in the last month. About 2,000 had used marijuana in the past, while 2,000 had never used the drug. They studied their body's reaction to eaten sugars, their levels of insulin and blood sugar levels while they have not eaten in 9 hours, and after eating sugar. Not only are thin pot users, but their body has a healthy response than sugar. 7. While not really a health benefit, marijuana stimulates creativity in the brain. Contrary to stereotypes, stoner, marijuana actually been shown to have some positive psychological effects, especially in terms of increasing creativity. Although short-term memories of people tend to function poorly when high, people get better tests requiring them to come up with new ideas. One study tested participants' ability to come up with different words related to the concept and found that using people are allowed to cannabis come with a greater variety of related concepts, allegedly to make the brain better identifying associations, remote ones that lead to new ideas in the extreme, according to Wired. Other researchers have found that some of the participants to improve verbal fluency, their ability to come up with different words, using marijuana. Some of this enhanced creative ability may come from the release of dopamine in the brain, reduces inhibitions and letting people feel more relaxed, giving the brain the ability to perceive things differently. 8. Marijuana protects brain after stroke. Nottingham University research shows that marijuana may help protect the brain from damage caused by stroke, by reducing the size of the area affected by the stroke, at least in rats, mice, and monkeys. This is not the only study that showed neuropsychological effects of cannabis. Some studies suggest that the plant may help protect the brain after other traumatic events, such as a concussion. 9. May help prevent nightmares. This is a tricky one, because it involves phenomena that can be both positive and negative. Marijuana interferes with sleep cycles by disturbing the later stages of REM sleep. In the long run, this could be a problem for frequent users. However, for people who suffer from serious nightmares, especially those related to PTSD, it can be helpful. Nightmares and other dreams occur during these stages of sleep. By interfere with REM sleep, those dreams may not occur. Research into using synthetic cannabinoids such as THC, but not identical, to a significant decline in the number of nightmares in PTSD patients. In addition, even if the frequent use can be about sleep, marijuana sleep aid might be better than some other materials that people use. Some of these include drugs and alcohol, can also be potentially bad effects on sleep, although more research is needed on the subject. 10. Marijuana can help people trying to cut down on drinking. Marijuana is safer than alcohol. This does not mean that it is completely without risk, but it is much less addictive and does not cause nearly as much physical damage. Disorders such as alcoholism involve disruptions in the endocannabinoid system. For this reason, some people think cannabis may help patients struggling with these disorders. Journal Reduction Impact study shows that some people use marijuana as a substitute less harmful alcohol, prescription drugs, illegal drugs and other. Some of the most common reasons that patients do replacements are less negative side effects than marijuana and the fact that less can cause withdrawal problems. Some people become psychologically dependent on marijuana. It does not mean that it cures problems substance abuse. But, from the perspective of reducing brain damage, it can help.